Hello and welcome. My name is Shaun, and I'm one of the advisors on the Women in Global Health Seattle Advisory Panel. Thank you for joining us today. We're excited to see everyone here for our WGH Seattle quarterly gathering today. If you'd like, in the chat, please share your name and organization so we can see who's present today. Before we begin our program, let's take a moment to ground ourselves and to respectfully acknowledge the land where we are today. For those of us in Seattle area, we acknowledge that we are on the unceded territories of the Coast Salish people, including the Duwamish, past and present. If you are joining us from elsewhere in the US country, we invite you to learn more about the tribal land you occupy by visiting the link in the chat and to truly commit through words and actions to demonstrate respect, support, and rights to the true owners of these lands. Our special event today will center around the topic of community wellness with a panel discussion. We have three wonderful panelists who will be joining us for this insightful discussion. I'll go ahead and pass it off to Hallie Pritchett, one of our Women in Global Health Seattle advisors, to kick off today's conversation.
Hi, everyone. My name is Hallie Pritchett. Thank you, Shaun. I have the pleasure of introducing our topic and introducing our panelists today. So I wanted to really quickly start off with just an introduction to the concept of community health. It's a term that we use a lot in global health and public health, and it kind of melds together with a lot of different concepts and meanings. And when we often think of it here in the United States, this kind of socially dominant mindset of what community health is goes to that individualistic wellness perspective and finding those access to things like screening and care. And that is certainly a part of it, but we wanted to make sure that we were looking at community health from the perspectives of many different communities and the perspective of the concept of wellness from many different communities as well. And so that is how we found our amazing panel today. So I'll very briefly introduce our panelists, and then I'll ask them a quick question to get a little bit more in-depth introduction. But we have Tia Benally, who's a research coordinator with the UW Seven Directions Indigenous Public Health Institute. We have Ndudi Chuku, who is the executive director of Mission Africa. And we have Genya Shimkin, who is the founder and CEO of the Q Card Project. And I'm so excited to chat with everyone today. So I will start with asking you all just a quick question to kind of get those further intros going. And that question is, how do you define community wellness within the context of your community or communities? And I think just for ease, I'll kind of shout it out for this intro one. And then otherwise, as we go through the panel, if you have something to say, just go for it. So I will say, Genya, because you're first on my screen, go for it.
Sure. Thanks, Hallie. So nice to be here. And thank you for the warm welcome. So my name is Genya. I use she and they pronouns. And just to the intro question in the chat about what are we doing to mark International Women's Day, I really like supporting women-owned businesses, particularly in spaces where it is harder to find women-owned businesses. So right now, as we speak, I have a woman-owned electrical company doing work in my house. So if you hear any loud banging, just know it is a woman. I have a fabulous woman-owned electrician in Seattle if anybody needs a recommendation. So I think in my mind, I think I would have answered this question really differently a few years ago. And I think speaking from the perspective of queer and trans health, which is very much the space that I am here sort of representing or speaking about as a queer and genderqueer person who sort of struggles with concepts around like womanhood and do I fit and am I the right kind of person? I think for a long time, I would have defined wellness more like you were saying, Hallie, in sort of individual, like clinical outcomes type of ways. And now that my community is actively under attack every day across the country, I feel like more and more I'm thinking of wellness in terms of like freedom from, right? And not just like I don't have specific clinical diseases, right? But like freedom from legislative terrorism, freedom from people trying to control your body and your ability to make medical decisions, freedom from like predatory politicians who think they know better than you do, right? I think for me, wellness is so much about freedom. It's about liberation. It's about giving ourselves the space to be whole people and to like feel nurtured in that. So, and I think, you know, when I think about the connections between queer and trans health and the sort of traditional women's health space, right? Queerphobia and transphobia is all rooted in the same white supremacist misogyny, right? So violence against queer and trans people is gender-based violence. And so I think in a lot of ways, when I think about community wellness, right, I'm thinking about what does it mean for all of us to be free, not just queer and trans people, not just women, not just Black and brown people, not just Indigenous people, right? But that all of these struggles are connected. And in order for any one group to achieve community wellness, right, we have to be working towards that wellness for all of us. So I think that's where I'm sitting right now, especially in this moment of really scary legislative attacks on my community.
Thank you, Genya. T, would you like to go ahead?
Yeah, sure. Okay, so I guess before I start, Yat A Amlato Tia Benally Inishye, Twitch initially, Sinajani Bashing, Latlane Dashcheo, Do Kiani Dashanale, Ado Yatahe, New Mexico de Nashak, Seattle, Washington, de Kesht, Alcot Ego, de Nestan, Nishle. So hi everyone, my name is Tia Benally. I'm Navajo, White Mountain Apache, originally from New Mexico. Basically, I just wanted to greet you all in the way we like to welcome each other into a space. If I have any Navajo relatives out there, hello, hi, welcome. But in regards to community wellness, I think what hits home for me is connection. So as I mentioned, I'm from New Mexico, and I started graduate school at the University of Washington, and the first year was all online. And so we're still in the pandemic, but this was like right at the peak of it when everyone went home. And so also it was the opportunity to start a new adventure for myself. So that was graduate school. And it was really hard because a lot of people who entered the graduate program really wanted that connection to each other. We were coming from different parts of the world. And so we had a common goal, which was public health. And so now out here in Seattle for over a year or so, I'm craving that connection again, and in regards to community. So being out here, it's different than the Southwest. So if you're familiar with New Mexico, we're really diverse in a sense that we have a high brown and Black population, and specifically Indigenous communities. So prior to coming here, I did a lot of tribal work. So I worked with our 20 Pueblos, Navajo Nation, and Apache tribes out there. And so I had that connection like every day. I was just talking to my sister. I was like, wow, I spent like 75% in the field with these communities, traveling every other week. And so I got used to that. And so that was a little bit cut off during COVID. And now here at Seattle, I came here, took the opportunity, don't really have family out here or at all. And so I think every Indigenous person that I've connected with, we naturally gravitated towards each other, whether, from my own tribe or one of the other tribes. We're just like, we need more Native folks, because what means wellness for us is having that connection to each other. When we do something, we don't just do it for ourselves. I think colonialism is really grounded in individualism, the American dream, and that's not for us. We see success as if one of us succeeds, then the rest of us succeeds, but it's not alone. Back to my graduate program, my whole family, my grandma got on a plane for the first time from New Mexico. She left to Four Corners just to come out here to celebrate me. And, the MPH wasn't just for me, it was for me and my family. So I guess just to close out the answer, as an Indigenous person, as a Navajo woman, what community wellness means for a lot of us is just connection to each other and establishing that safe space that, while we're away from the reservation, we'll be okay, because at least at the end of the day, we have each other. And so I'll toss it off back to Hallie.
Thank you so much. Go ahead, Ndudi.
Hi, everyone. I want to say happy belated International Women's Day. For me, community, when you talk about community wellness, the first thing that comes to mind is what community are you talking about? Because we belong to different communities. But today, I think I'll just focus on the community that Mission Africa represents and the people we serve, which is mostly refugees and African immigrants. So, when you come to the United States from Africa or from, some other countries, one of the first cultural shock you have is, the lack of community or the sense of belonging, like T was talking about, because we come from a place where you can just take your child, knock on the door of your neighbor and said, okay, this is my child, I'm going to the market. Take care of him or her, okay? I'll see you soon. And they will say, yeah, and they will take care of your child. We come from a place where, it really takes a village to raise a child. So when you don't have or you don't feel that sense of community, it kind of begins a whole lot of feelings for you. And then the community we're talking about that Mission Africa serves is the immigrant communities. So community wellness for me is having the resources you need, to stay well, to be healthy, to be productive, to take care of your family, not having to deal with all the things that, people have been dealing with for years and for decades, being able to, pass over some of those barriers, just having what you need so that because, one of the things we say, being colonized by the British, when they say, how are you? You will say, very well, thank you. For you to be very well means that you have everything you need. It doesn't mean you're rich. It doesn't mean that, you have money all over the place, but it means that you have enough for your household and you don't have to struggle to have the basic or to meet your basic needs for yourself and for your community. So for members of my community to be well, or for my community to be well, that is what Mission Africa fights for every single day.
Absolutely. Thank you. Thank you all. And I really love this kind of as an introductory question, because we get to know a little bit about you and your communities and your people. And it's not just the traditional, hello, I work for this organization and that's it, right? So thank you very much. One of our first formal questions for this panel is another kind of terminology question. We are here with Women in Global Health Seattle chapter, and we wanted to touch on the concept, the term global health a little bit with this group. So in the United States, again, when people hear the term global health, we think of places often that are international to the United States. But one thing that you all have in common is that you all work with communities here in the United States, in some cases as well as internationally. And so I was wondering if you could talk a little bit about how your work is inherently global health, both here and abroad. And actually, Ndudi, if you wouldn't mind starting us off, that would be wonderful.
Sure. So healthcare, even in the United States, is global because, the immigrants actually make up 13%, and I'm going to read it here, 13%, 13.6% of the US population, 28% of the country's physicians and surgeons, and nearly 38% of home health aides. So even when you're receiving any kind of healthcare, it's global health, because if you can close your eyes and imagine any remote health clinic you've been to or very urban health clinic you've been to, there's an immigrant there. There's an immigrant woman there. And, for Mission Africa, we started in Nigeria. We started doing free medical, outreaches in remote villages. And we did that. We started in 2002, and we will go to all these remote villages and we'll offer free medical services, free eyeglasses, hygiene education, health education, and then we do referrals for people who have more serious ailments. And we did that from 2002 until, believe me, 2020, when COVID hit. We realized that, there's just so much we can do here. apart from our basic pre-medical outreaches that we did there, we also partnered with some organizations like Palcare, that do hygiene products, and they do menstrual products. So we worked with them. We worked with Britzy Ladies. We worked with Safe Aid Foundation, because there are a lot of kids who need eyeglasses in the villages of Africa, and they cannot go to school. They can't see when they go to school because their parents are not able to provide those. So we were doing that until 2020. And we realized that there's so much. In the first place, we packed. We were ready to go to Nigeria as always, when we were told that we couldn't travel. So we started looking inwards and in our local communities to see what we can do. We started doing vaccine clinics. We started doing community care fairs with our own community, trying to educate people on COVID, trying to debunk some of the myths about COVID vaccine. Whatever we had to do, we started distributing food, whatever that was needed, diapers, anything that we could do, whatever our community members needed, we will find a way to, bring those resources to them. And like I said before, our target population are immigrants. So we were doing whatever we can, healthcare, to health-wise, to support them. So for us, we partnered, we did a project in 2022. It was called the African Health Advocacy Project, and we worked with over 30 African-led organizations. They were reaching out to their own communities. They were, doing a survey. They were finding resources for their own communities. We partnered with a lot of people, and they were reaching their people. So it doesn't get more global than that. So for me, when you are in the United States and you look around, your doctor, your nurse, your technician at the hospital, you look around there, mostly immigrants. So we don't even have to go far, to see global health. We don't have to go far to experience global health, because everybody comes into America, and most of the workforce in America, when it comes to healthcare, are immigrants. So I think already receiving healthcare here is global health, because look around you and look at the people who are helping in that area. It doesn't get more global than that.
Thank you. And I this is why I love speaking with so many different people. You've already expanded my perspective of what global was. It's one answer that I didn't have already. So this is an expansion. I love this. And I also really wanted to point out that you were speaking to that wholeness, that you were providing diapers and food, and that is part of health, right? There's all of those elements.
Yes.
Perfect. Thank you.
Yeah. And I can expand more on some other programs, but I'll give my colleagues a chance to speak.
Sounds good. I think we'll probably have a couple more questions. We'll be able to tackle that
Okay.
as well.
All right.
Tia, I know you have a really interesting perspective on some of this too that we were hoping to make sure to cover.
Yeah, of course. I don't know if those in the room are a little bit guilty of this, but oftentimes when I think of global health, it's like hopping on a plane and going somewhere else that's outside of the US. But as it was touched on earlier, global health is here. And, definitely emphasize that, because, and this is my personal opinion, and I feel like oftentimes when we think of global health, Indigenous populations are left out of those conversations and spaces. And it's because maybe it's a realm of unknown. There's over 500 tribes of us out there. And so representation does matter for us. Speaking about my tribe back in New Mexico, specifically the Navajo Nation, we're the largest reservation, which also means we're the tribe that needs the most resources. So I remember coming to the University of Washington and having these conversations with people who either were born and raised in the Pacific Northwest or never took the opportunity or chance to learn more about the Southwest. And so when I would describe things such as, living conditions for Navajo Nation, for example, it was kind of like a harsh, reality to them, a reality check in a sense, because I had mentioned You know, in graduate school, you get this like great surge of energy because you're like, I want to create these programs and these policies with this imaginary funds, which is great. You know, the passion is there, but a lot of it came back to, is this realistic? Because I can honestly say it wouldn't be realistic for us, because oftentimes these programs, what makes them so successful is that they have access to the urban resources, whereas a lot of Navajo Nation is rural. And so just to give you a sense of how big it is, it's about the size of Rhode Island. And so you think about that and it's like, okay, you know, when I think of a size, you know, they have access to things such as water, electricity, roads, and these are just things that just seem kind of impossible to achieve in Navajo Nation, which is crazy because it's the United States. You know, I have relatives who still don't have running water or who don't have electricity, that have roads that are basically impossible to access now because of the amount of rain they're getting, but also the amount of snow. So when that snow melts, a big memory of me growing up is the snow was fun, but I hated afterwards, which was the mud and walking to the bus stop. And the bus stop wasn't, you know, just around the corner. I see people outside of my my house that I'm in right now, and they're all gathered at the bus stop. And I'm like, man, it'd be nice if my bus stop was that close, because I remember wrapping our shoes up in like plastic because, you know, we wanted to protect them. And so thinking about those kind of things, you wouldn't know, basically going back to lived experience, or you don't know until you know. And so that to me is global health. And like, how can we make room, you know, for more Indigenous voices? Like I said, I'm just one out of over 500 tribes, and I'm just a small part of Navajo Nation. So not only like increasing Indigenous populations, but also, you know, representation. So I think that's all I'll say for now, and it'll probably come out a little bit more in a lot of our other questions you have set up.
Absolutely. There's a reason I'm staying muted while you're all talking, so that I don't just jump in and start continuing. I know, like, there's so much we want to say.
Yes, I am always appreciative of opportunities to bask in T's brilliance. So, and you know, just to piggyback on this a little bit, you know, our Indigenous nations are also sovereign nations, right? And so I think that we often talk about like other countries without recognizing that we have sovereign nations within our borders, right? I'm one of those people that's like, well, in a perfect world, borders don't exist, but we don't live in a perfect world. But I think one of the things that I think about a lot in terms of the queer and trans health space, in terms of global versus local, insofar as they are a versus at all, so I actually think that homophobia and transphobia are one of the US's biggest exports historically and presently, right? We know that trans people, non-binary people, intersex people, queer people have existed for as long as we have records of human existence, many of them in countries that have since been colonized, right? And it was actually colonization that wiped out a lot of that gender and sexual diversity. And then when you start to see sort of increasing numbers of people coming out, right, we see these backlashes. And so, you know, a handful of years ago, I think this might have been when I was in graduate school, actually, there was this, you know, Uganda was in the news all the time about this horrible homophobic bill they were going to pass, right? And there are all these well-intentioned white people in America talking about like, oh, those Ugandans. And I was like, hi, where do you think they got the idea for this bill? Like, it was white evangelicals from the US who went to sub-Saharan Africa spewing their homophobia. Like, homophobia and transphobia are not indigenous to any part of the world, except maybe the countries behind all of this colonization, right? And so I think when we think about, you know, what we're doing in the United States cannot help but have these ripple effects on other parts of the world, because imperfect and broken and messed up as we are as a country, many other countries still look to us as an example in a lot of ways, which I actually think is really dangerous right now, particularly. So if all of these states around the US start succeeding, I think it was the state of Tennessee is now trying to pass a bill that would allow county clerks to deny marriage licenses to same-sex couples, even though we have a Supreme Court decision that said, right? it's like, if this starts happening and more of these bills start passing, we're going to see them spreading in other parts of the world too, right? It is not a coincidence that we had Trump and Bolsonaro in Brazil at the same time, right? This backslide into fascism, if like we don't all try to stop it, right? What happens here starts happening in other parts of the world. And when it starts happening in other parts of the world, it really starts hurting the folks that don't have the political capital, don't have the social capital, can't just pick up and move, right? It starts affecting some of our most marginalized community members. So I think everything about queer and trans health work in the US becomes global just because so many other countries look to us for example, and because frankly, we export a lot of that really homophobic and transphobic morality to other parts of the world in what feels in a lot of ways like just a recreation of that colonization cycle. So I'm going to hop off my soapbox there, but suffice to say, right, like what we're doing here really does matter for the rest of the world. And queer and trans people in other parts of the world, I guarantee you, are looking to us to see what is going to happen over the next 6 months or a year as different states grapple with 400 anti-queer and trans bills that have been introduced across this country so far in 2023 as of March 9th.
So Genya, your answer actually is leading us perfectly into another question that we have for the panel. And that is, what do you think are some of the biggest challenges, access barriers, bias, et cetera, facing community wellness efforts? And if you have any thoughts on this, what can we do as global health practitioners to overcome them?
Yeah, I mean, I think this sort of cultural queerphobia and transphobia are sort of the ultimate barriers here, right? A big part of this is all of us doing our own work to understand those biases, understand where they come from, break them down, right? Understand that all of these folks coming out as queer and trans now is not like a new trend, right? It is actually a return to historical ways of being and historical knowledge, right? And I often think about, think about all of the systems in this country, right? All of the systems in the United States are built on this bedrock of like white supremacy, right? And this idea that some bodies, some values, some bodies and some ideas have value and others don't, right? And queer and trans people were in the bucket of like, these people do not have value, which means our education system, our law system, our medical system are all set up on this same bedrock, which makes it harder for queer and trans people to survive, let alone thrive, right? Because it is harder, we are more likely to be targeted by police. We are more likely to be uninsured or underinsured, more likely to live in poverty, more likely to not access higher education, right? 40% of young people in this country who are unhoused identify as LGBTQ, right? Many of them because they were rejected by their families, some because they aged out of foster care where they are also overrepresented, some of them because they aged out of juvenile detention where again, they are also overrepresented, right? And so when you think about barriers, and of course, queer and trans people exist across every other social characteristic we have. So if you think about like queer and trans people of color, right? Black trans women who are literally being murdered in the streets, many of them by intimate partners, right? The life expectancy in this country for a Black trans woman is 35 years old, right? I turned 37 in 2 weeks. This does not feel great to me. Right? But this is the reality where we're living, right? So the most marginalized in our community are experiencing huge barriers. Whereas, like I'm white and I have a graduate degree. And so I have access to certain types of privilege and certain systems. And I still get weird looks in the bathroom from time to time, right? Like I still get people who don't take me seriously. I still get people who roll their eyes when they hear that I use they, them pronouns, right? And these are microaggressions for me, but many in our community are dealing with very serious and life-threatening barriers, which is part of why I think a lot of these law proposals that we're seeing now, which would ban gender affirming care for minors and for adults, are so scary, right? Because our bodies and our existences have been medicalized to the point now where this is a new method of control over us, right? You don't have control of your body. You don't have control of your destinies. You don't have control of your identity. And where does that leave you? What do you own after that? And so I think the biggest barrier we're up against is a culture that continues to say there is something wrong with queer people and trans people. And it bleeds through every system we have in this country, which makes it, we end up having to advocate for ourselves, some more than others, sure, just to get some of those basic needs met. And I think that that's a barrier for every community.
Absolutely. And I find it really interesting you touched on those microaggressions and then those macroaggressions.
Yes.
And it's a systemic and cultural normative issue, right? It's this large.
Totally. The mega aggressions.
Right.
Yeah.
Right. Ndudi, do you have some thoughts on this one?
Yes, of course. So talking about being underserved and being marginalized, of course, I have thoughts. So, we don't have enough culturally relevant, education for our people in terms of, all the services that we need, because it takes somebody who understands you, somebody who knows what being culturally relevant means to communicate effectively with you. So a lot of times when we learn better when we're taught by people, of our own community, because it's not just the way you say things sometimes. It's not what you say sometimes, or the way you say it. It's not the way, what you communicate, but the way you communicate it. So when it comes to immigrants, we don't have a lot of resources that are intentional, for us. So we have to continually fight to get things, because it has been like that for years and years. So we are trying to change all that. That's a major barrier, not having, programs and services that are intended for the immigrant communities. Again, some people do a one size when it comes to programs, a one size fits all. It's not like that. Most times when people say culturally relevant, they are talking about languages. Let's translate these things. Let's bring materials that anybody can read. Let's, interpret them and translate them into multiple languages. That's not the point. People want to be at the table. People want to be included in the conversation. A typical African man will die hungry instead of receiving something you throw at him or her, because people have dignity. They want to be part of the conversation. They want to be respected. They want to be heard. The fact that you think I'm hungry and you throw food at me doesn't mean that I will accept it or appreciate it, because I would rather you ask me, what do I want to eat? What you have to offer might be, more nutritious, but I would rather you ask me so that I can have a voice at the table to say. So it's just more of inclusion, more of having programs that are more, very appropriate, removing the language barriers, programs that, can be offered to even undocumented immigrants without having to ask for this paper or that paper. We have had to serve a whole lot of people. I thank God that during this pandemic, a lot of all those things were not, you don't have to take a lot of information from people to give them the services they need, because the pandemic just exposed that you just can't do that. So we stopped taking a lot of information from people in order for them to benefit from what you have to offer. That's good, but we have to think about all these basic things as, basic human needs. You don't need to come from anywhere to qualify for anything. Basic as food, education for your children, healthcare. Yeah, so for me, all those barriers that we have experienced for years just because you don't sound like other people, you don't look like other people, you don't have the education qualification, you're not able to express yourself. Right now, we are offering, digital navigation to our community, and not to derail us. But you find out that a lot of people who come to this country as medical doctors, they are working as, CNAs, just because of the language barrier, just because nobody looked into tapping from that resource. Nobody looked into all the skills, all the wealth of knowledge that they brought, into this country because of all those barriers, language barriers. So we have to find ways to kind of remove the barriers and bring us to a level playing field. I don't know if that exists, but that's one of the terms we say. And people can be able to be productive and be able to impact their community the more. Because when you come into this country as a professional and you find out that you just have to survive, what do? You go to the lowest of the low. But those are barriers that we'll continue to have. But if we have programs and services that are intended to remove some of these barriers, then you know that every community will thrive. And when we talk about community wellness, then we can all nod and say, oh yeah, that is happening, because at least I have the ability and I have the resources to change things for my family.
Absolutely. Absolutely. T, do you have something? Go ahead.
Yeah, yep. Yeah, I definitely resonate with a lot with what's already being said, but I guess something I'll touch on briefly is just, access to resources. It sounds like easy enough, right? Okay, here are the resources in order to address basic human needs, but it's not as simple. So like, for example, for Indigenous communities, it's often a myth. And I say this because oftentimes non-natives will come in and be like, well, we want to partner with you all, but we also know that all natives receive healthcare, and not all natives don't pay taxes, wherever that came from. But also like noting that, healthcare, while we do have the Indian Health Service, it is provided by the government, but that was like an agreement, like that was in our treaties. And if you've been through the IHS system, you know that it's subpar, it's 80% underfunded. So it really comes down to like quality over quantity. And so working in the realm of like public health, it kind of just reemphasizes that the US government has a big grip on Indigenous communities, and it will look different for every tribe. Specifically for ours, because we're like the largest reservation, we do have multiple IHS places. They're not the best. And I'm saying that because I also was born in IHS. So I'm not trying to say any shade there, but it's the reality. And so I think just answering that question, it comes as far as like how to overcome it for Indigenous communities, it's sovereignty. And we like to say like, yeah, we're sovereign nations and we have that government to government relations, which we do, but it's also figuring out how to get out of the government's hold, how to increase those resources to do what we want to do. Right now, the work I do, a lot of it is checking the boxes of whatever the guidelines are. And oftentimes this funding comes from places like the CDC, and the CDC just wants you to hit their marks, wants you to turn into paperwork, wants you to have evidence-based practices, because anything other than that, it's a hoax, and it doesn't help, or it doesn't work according to them, of course. And then oftentimes when we're creating these frameworks, it takes a while because you want to include the community. It was said before, we're not a one size fits model. So then that means we need perspectives of the elders, of the youth, of other community members in our tribes. But that's going to take a lot longer than maybe a 12 or 16-month grant. And so I think recognizing right now is that, I'm tired of rushing. I'm tired of like pushing communities to focus group after focus group, fill out these surveys. Here's your $5 gift card. That should be enough, right? No, it's not, especially on the Navajo Nation, when people have to drive several hours to a convenience store. On the Navajo Nation, we only have 13 grocery stores. It's kind of baffling to me because right now there's a grocery store at every corner here in Seattle. And so going back to that, looks different for whatever community you're representing. And honestly, I think the key driver for us is exercising our sovereignty and becoming fully functional without the help or need of the government, because that's worked out so well for us so far. And that's sarcasm. I'm entering sarcasm, but I'll give back to Hallie.
No, I appreciate that. And I really like that you brought up that concept of equitable resources, right? What's actually needed for each group and each community and subcommunity, and making sure that that is incorporated in putting together funding allocation and other resources that we know right now is not determined that way at all. Actually, T, I'm going to start with you for this next question. And this is kind of building on a little bit of these barriers and everything that we just talked about. And this is, how can institutions, yours, ours, others, work to build community power in healthcare and research spaces? What should we be doing? What can we do better?
Yeah, I think I probably touched on it a little bit earlier, but recognizing, acknowledging that tribes are sovereign, and that what may work for maybe a tribe here in Seattle, such as what might work here may not work in the Southwest. One, our climate is completely different. When I go home, I'm like, wow, like it's a desert out here. We have limited water and it's very dry. Whereas here, you get the point, it's polar opposite. But recognizing that and understanding that the community already has the answers to whatever, the researcher. And the thing is, like, Indigenous communities, we're tired of being the focus of your thesis, the focus of your dissertation, the focus of how many papers you need to produce to gain whatever milestone you want to be at in an institution. Like, we're not here to be picked and probed and for you to gain all this recognition. It's understanding, if you are a non-Native person, okay, I have these skills, I'm privileged enough to have access to all this education. How can I then include the community, as far as like, maybe there's somebody that you can pass on these skills, and taking the backseat approach. I know it's like, oftentimes in my community specifically, there's that top-down approach. You have the researcher, we think they know what's right because all of the credentials that come with them, and then they're telling us how to live. They're creating these programs that don't work for us. That goes back to this model that is not working for us, because you're not including things that are vital to us, like our language. Our language is a big component. Another thing is like our cultural knowledge. So in regards to like, what do we need to feel healthy? Oftentimes, we're prescribed like, okay, here's a pill, magically get better, or exercise and do this amount of physical activity and you're going to be healthy. And it's like, no, that's not going to work for us. So I guess back to institution is creating those relationships and thinking about, at the end of the day, what you're asking, that reciprocity, right? You're not going into these communities and saying, I need X, Y, Z things because of my deadline. And it's like, whoa, we don't even have that bond. You just came in here with the false intentions that you wanted to come and help because you thought of this great grant. And I think the final thing I want to say is recognizing like Indigenous data sovereignty. So as we know, a lot of populations, the data is a form of erasure, especially for us, out of policies, out of program planning, and the list goes on. And so recognizing that the data that is collected is going back to the tribes, and that it's going to go back to Native researchers. And so it's going to take some time, and it's going to be a while, because but back to sovereignty, we have to consult everyone, our elders, our youth, our tribal council, our tribal leadership, and ensuring that the research is going to be done in a wholesome way and for the benefit of the community, which honestly, at this point, there's not a lot of examples of where this has been done. So changing that narrative.
Absolutely. Thank you. It sounds a lot like we, as the institutions that are represented in the audience here, right? We need to be doing that disciplinary self-critique and really thinking back, are our systems perpetuating exactly what you're saying? Are we actually taking the time? Are we building in the time we may be pushing back against the funders. I know that's one thing in academia. We don't push back against the funders at all. We're like, oh, this is what the funders say. We must stick to it always. But like, I bet if we had enough academics pushing back against those funders, we get a little bit of shift in some of those funding structures, right? Ndudi, do you have some thoughts on some things that we can be doing?
Yeah, I just want to, piggyback on something T said. He says the community already have the answers. And if that can be recognized by funders, by whoever, that would be wonderful. We did a project, the African Health Advocacy Project. It was a Department of Health project. And it was for about 4 months. About 95% of the vendors we used for that project were Africans. We worked with 30 African-led organizations that people did not even know existed. And the reason is because DOH was kind enough to, approve some stipends for these organizations. So, you cannot be more Catholic than the Pope. It doesn't matter how passionate you are about Nigeria. You cannot be more passionate than me because they are my people. They are not statistics to me. They are not numbers to me. So we had these organization leaders reaching out to their own organization, finding out how they are doing the surveys, being able to reach out to them and find out exactly what they needed. So I'm just saying, if that can be recognized, that every community has the answers. It's just that they need to be encouraged. They need the resources to thrive. They need the resources to be productive. They need the resources to use what they have to help their own people. But sometimes you don't even know until we got that grant that gave us kind of, the freedom to target African immigrants. It was amazing. It was amazing. So we need more of those. we need more opportunities for people to kind of thrive in their own community, use their skills and talents to serve their own community.
Absolutely. Genya, go ahead.
So many thoughts. Short of just saying, burn it all down and try again, I have some thoughts. So I think a few things to keep in mind is when we think about how can institutions work to build community power, and we think about the fact that communities already have the answers, right? Part of this is that we have always known how to take care of each other, right? And we keep showing up to do that despite all the garbage, right? So it's not a joke, but I say it sort of jokingly to people all the time. If you know anybody who has taken medications for HIV, thank a queer or trans person, right? Because it was the queer people dying of AIDS in the 80s who literally changed the way that drugs are approved by the FDA because they were like, no one is going to go to bat for us here if we aren't willing to do it ourselves. And many of them had to die under shameful circumstances to prove a point, right? Which nobody should have to do. But what it does show us is when we know our history, that is a form of power in itself, right? When we know, and they intentionally try not to teach us that, right? Especially as queer and trans people, we don't know our history. It's existed for as long as humans have, but nobody ever talks about it, right? But when we start to learn our history, that is a form of power. It's a form of resilience. It's a form of voice because we're saying, you can't kill us off. You keep trying, and yet we keep coming back, right? So yes, the hidden histories, exactly, right? And I suspect this is true for other communities too, right? When we know our history, we can say, we know you've tried this before, and we know that when we all came together, we defeated it, right? So I think part of this is knowing that history and teaching that history and sharing that history, right? This is a lot of work I do through Q-Card as I meet with queer and trans young people and I teach them that history, like in healthcare and more generally, right? How have we showed up for each other? How have we fought back against these systems? What have we been able to change? Look how far we've come. Here's where we still have to go, right? So that's one thing. In more sort of like concrete action steps, if you're writing a paper, you better have an author from the community that you studied. Right? You better have an author on that paper who represents the perspectives or the experiences that you're writing about. And I was actually I had dinner recently with a friend who's a colleague who's a professor in Epi at UW. And she said that she thinks one of the major global, I think it's an HIV journal, actually just changed their authors' guidelines to say that if you are a researcher from a majority white institution and you are writing about a country that is majority people of color, people of the global minority, right? Either the first or last author needs to be someone from that country, which I thought, like, not, like earth-shattering, but progress maybe, that like you should be very clear that you had a partnership going and that someone else is sharing the credit for that work, right? Because I think there's a really long, ugly history of public health work and global health work as an extension, right? Of being a form of that extractive colonialism, right? Where it's like, we go there, we get the data, we leave, they get nothing, I get a big award, right? And I think we're seeing this a lot in queer and trans health research too, where a lot of the lead researchers on trans health are not trans, right? And so do not sit at that intersection of lived experience and expertise. They might sit in this space of having some expertise, but what does your expertise mean when held up against somebody who's lived it, right? And so I can tell you for myself, if I see a headline or if I see like a journal article about queer or trans health, I will look you up. I will look up your affiliations. And if I can't figure out, like, how do you fit into this? Like, I need to see queer and trans representation on your research teams. And now that I've reached a position in my career where I can be doing some of that recruiting for like student researchers or collaborators, you can bet that I am being very intentional about the students I work with on certain projects, right? Partly because they deserve to have that mentorship. They deserve to know that there are people who look like me, who have an experience similar to mine, who maybe get it in a way that other people don't, who are mentoring them through this work, especially because, like I said, a lot of queer and trans people are denied access to higher education. So like when I'm working with a first generation trans student, you can bet I am tagging in all of my queer and trans research friends to try to find that student fellowship funding, a TA position, right? This is one of the ways that we show up for each other, but we also need our allies to be thinking about this, right? So that's another thing. And then the final thing is just remember that like diversity, equity, and inclusion is not a checkbox and it's not a person. Right? We can't say, oh, we've done our duty, we've done our due diligence here because we have XYZ person who is diverse. That's not a thing, right? This is a framework we use for thinking about how people's different experiences enrich the whole team and enrich the project. And so I think being really thoughtful about the different ways that people's experiences bring something really important and valuable to the team, to the work, to the project, to the organization, has transformative power in itself. And I think if you're going to start bringing more people onto your team who have these diverse experiences, folks in leadership and management need to be prepared to go to bat for them because a lot of these systems are going to be problematic, right? I used to work for an organization that had a super gendered dress code. And I had to go to them and be like, hey, I don't really fit into either of these categories. Your thing says that male supervisors are required to wear shirts and ties. And it says that female supervisors are supposed to wear blouses. And I was like, well, I don't wear blouses. Like, what does that mean? Also, I was like, girl, it is like 2017. Can we maybe talk about this, right? But HR could have just shut me down, right? So how do we think about creating spaces that let people bring their full selves? And then I just really want to echo something that both T and Ndudi said about this question of like, how are we measuring success and what do outcomes look like? I do think that funding mechanisms in this country, and especially in this like public health research space, are super oppressive in a lot of ways. One, in terms of like, who will they allow you to pay for the work? How much are they willing to pay for the work, which is often not very much at all. And I think that a lot of these mechanisms, enable the sort of white savior complex that we see in a lot of this work, right? Where they're like rewarding white people for having novel ideas that these communities have like, we've been doing that forever. Like, this isn't new to us, but I'm glad that you now have $1 million to come study it. Like, can we get some of that $1 million? So thinking about how we challenge those dynamics and what like capacity building means, because the other thing that a lot of folks like to do is they find a really cool model of a program that was started by Black and brown women, for example, around reproductive justice, and they contact that group and say, hey, we'd love to try this in our community. We just got a $5 million grant. We'll pay you $5,000 for like technical assistance, right? How are we moving resources into communities that have already figured out how to do this and do it well? So on my final thought on this is a lot of what I talk about and think about in my work is the difference between altruism and solidarity, right? And I like to think of the work that I'm doing in my community, not as like oh, I feel bad because I have privilege and access, so I should really try to help those less fortunate, right? But to say, I'm in this with you because I will never achieve freedom and liberation for myself if you aren't coming along with me, right? And that like we all across these different groups, across these categories, across these different sort of social group designations, like we have to all be in this together, because you can't have freedom for queer and trans people if Black trans women aren't included, right? We can't have freedom for immigrants if we don't also have freedom for Indigenous peoples, right? Like these things have to be connected and have to stay connected. And so I think one way that we can build some of that power is by reminding all of our groups, right? Because this is a tool of white supremacy to break us off into these small groups in hopes that we fight with each other, right? So part of this is undoing all of that and saying, if we're in this together, we are actually unstoppable. And that's where we build that power, I think.
Absolutely. I'm going to make the assumption that many in the audience are like me, and I want to just keep this conversation going. We have other questions, but we're out of time. I will say we've put in the chat, if you have questions that you'd like to type into the chat, we'll try to get to as many as possible. If you would like to ask a question of our panelists, you can also go ahead and raise your hand in the features here on Zoom, and we will try to get those addressed. We have about 15-20 minutes-ish for questions and answers at this point. And I will say to our panelists, in case you haven't been keeping an eye on the chat, I've seen a lot of the last chat is, this whole panel is excellent. And there have been a lot who have been saying this has just been a wonderful panel. The number of head nods and yeses people have been saying as they have been watching this has been amazing. So thank you all. Are there any questions in the audience? And I will say that I can't see the full audience. If you have your hand raised, I'm hoping it'll come to the front, but if those of you from WGH Seattle can help me keep an eye on that, that'd be great.
Hallie,
I'm just going to jump in because it looks like you're trying to track 17 things at once.
Please.
And this is maybe stacking the deck a little bit because I'm one of the advisors on the panel for Women in Global Health Seattle, and this is a topic that I had suggested a while ago, and I could not be more thrilled that like this has been such an invigorating and exciting conversation that has me I don't know, my brain is spinning, thinking about sort of how not only solidarity, but like how do you be a co-conspirator instead of a roadblock? But that's not the question I came on to ask. I think that one of the things that's like so challenging when we're doing this equity and justice work in our own communities is a different kind of resources, which is our own sort of personal resources. And so how do you think about your wellness and maintaining what you need to maintain when you're working on these heavy issues that affect you, your families, your friends so personally? How do you take that space? How do you maintain your own wellness while you do this really important work?
I'm just going to open this up to the panelists. If you have a thought, go ahead and jump right in.
Maintain my what? So thank you so much, Kitty. Those are I'm just beginning to learn to take a break. Get some rest. I actually got a grant from I forgot. I'm not thinking about BIPOC ED Coalition. They gave me a grant for sabbatical because I haven't taken vacation for so long. But I just came back from a six days vacation, which is a start. But when you're passionate about what you do, when you're wanting it to grow, sometimes you don't remember to breathe. So, and for me, learning to take some time to breathe. I'm learning to talk about things. I'm a typical African woman. We don't show weakness. We don't talk about things. It's like, so now I'm learning that sometimes you need a friend to talk to. You might not call that friend a counselor or therapist or whatever you call a shrink, but you can call that person a friend and go from time to time to have a conversation. It's very, very healthy, to do. So just taking the time to breathe. I remember during at the heart of COVID, almost all the Zoom meetings you go to, one of the one of the icebreakers is learning to breathe. I'm like, wow, this is good. Let's breathe again. And then you go to the next Zoom meeting and you breathe again. I'm like, this is good. We're breathing. But those things are very good, especially for somebody who is not very used to kind of taking the time to rest, taking the time to take a break. So it's being intentional and making the time for yourself to just breathe and take some time off. So we'll see. I haven't taken the sabbatical yet, but I'm planning on it. Thank you, Kitty, for that.
That sounds amazing. We'll have to follow back up to see how things go after the sabbatical. Go for it, too.
Yeah, I think, breaks are great. I think a lot of us can resonate with the feeling that graduate school like almost kind of killed me in a sense that I was highly stressed at the end of it. And kid you not, I got sick and I lost my taste, lost my smell. What does that sound like? Sounds like COVID, right? And so then I went in negative for COVID. And then I took a home test, negative for COVID. And then the physician's like, I think you're just stressed out. And then now finally, your body is fine. Like it got sick and it's like forcing you to take care of yourself. Unfortunately, I think all of us can resonate with that story at some point. So what I did when I graduated was I took 4 months off. I feel like during that entire time I neglected my family. And so I went back home to the reservation and it was like reacclimating myself. And it's kind of goofy because like here I just flip on a light for the heater and everything is accessible here. Uber Eats accessible, right? You can do stuff like that. But back home on the reservation, my family kind of makes fun of me a little bit. They're like, okay, like welcome home. Things are going to take it's a little bit harder out here. But, after a while of being there, it just it felt good again because I live in a multi-unit household in a sense that we all live in the same house. So I got to have conversations with my parents. I got to have conversations with my grandma and not feeling bad about it and not thinking I have an assignment, I have a deadline to meet. Like it just felt really good just to disconnect. Also, we don't have the greatest service out there. So I kind of was like, all right, off the social media, off my phone. So I think what really keeps me grounded is just going back to family. Though I'm here in the Pacific Northwest and I miss my family a lot, I'm very lucky that we have a close enough bond that I can continue to keep in communication with them, whatever avenue, call, text. I have my younger sister out here who's also at the University of Washington. So, remembering that, but also I think a biggest driver, and I think I can speak for a lot of like Native folks or Indigenous folks, is that purpose So earlier when I opened up my clans, and my clans are my connection to my mom's lineage, my dad's lineage, my grandmother, my maternal grandmother, and my paternal grandparents' lineage. So recognizing that, you know, I'm not just T, like I'm representing everyone in my family. And so understanding that, you know, while it's hard, it's the hours are a little bit intense out here, recognizing that, you know, at some point, you know, each of us that go home to the reservation, we're the toolkits, whatever lived experience we acquire out here, we're going to be able to take that resources back home. And it's not for a grant, it's not for a purpose, it's not to get publications, it's because we truly do care about our Native folks. One of those in particular is my grandma. My grandma spent a lot of time raising me and my cousins because it's a story that those that are familiar with, that our parents had to work. So my grandma took care of all of us. And so, you know, she took care of us so much that she neglected her health. Similarly to a lot of strong brown and Black women, she kept her health a secret. And so she was diagnosed with type 2 diabetes, which eventually went uncontrolled. And now she's on dialysis. And every time I talk to her, she's like, why did this happen to me? And it also doesn't help that, you know, that English is not her first language. Navajo is the first language. And so connecting with her and understanding that while I'm a good relative, trying to be a good relative to her, how can I translate that to like other people outside of my own close-knit family? So keeping that purpose, I think, can be a little bit stressful at times, because you have to say yes to everything, because if you're like me, you're like, I won't get this opportunity again. This opportunity is really awesome. Like, you know, I want other people to gain from this. But I think the final thing I'll leave with is what has also kept me sane is mentorship. And so finding those people I can seek out, both natives and non-natives, and understanding that, you know, they can be my sounding board. They can also just, you know, provide that like light at the end of the tunnel when I'm kind of spiraling and I'm like, I'm not going to make it, you know, welcoming those opportunities, but also, you know, paying that back. How can I be that representation, or even just like that nice comfort meal, a good res meal. The other night I made one because my sister was stressed out from finals. My roommate was stressed out from work, and also me similarly. And I was like, I'm a log off, 3 p.m. I'm logging off. I'm making a res meal. And that was just making a good, and it's so like interesting how food brings us together. Oftentimes we don't eat because we're hungry. We want to connect with each other. And then we ate that meal together, and it was like, everything's going to be all right. I don't know. It just like this meal, everything's fine now. So I guess I'll toss it off to Genya to finish us out.
Yeah, T, I love that. I think you're totally right. I think COVID really changed my relationship to food in a way that has been actually really good for my heart anyway, in that I'm spending so much more time at home that now that I actually have time to like make myself breakfast, and like I'm trying to avoid the sad desk lunch now, right? I like take a break and I go eat my lunch. And like my partner and I are doing a lot more cooking now because no one's like rushing home from work, right? Which has been really nice. And I think so, like, okay, real talk. Capitalism is a joke, right? And it thrives on all of us burning ourselves out because of this idea of like productivity and how productive you need to be in order to XYZ, right? Which is super ableist to begin with, but also it's a trap, right? It's a trap that keeps all of us from being fully well, I think. And I think if you can find yourself in a space or an organization or a team that gives you really good balance, it's a gift. It's also a rarity, right? And I think in a lot of ways, I have found that. My like day job, I'm split about half and half between the School of Medicine and the School of Public Health at UW. And I've got fantastic teams of colleagues that, you know, I can go on vacation for 2 weeks and not check my email, and it is not a big deal. It is okay. Like, I trust my colleagues, we trust each other, we look out for each other so folks can take time off. And I also, like, we all sit with the knowledge that, like, I like my job, I'm good at my job, I'm proud of the work I do. I am not so important that anything is going to crumble if I take some time for myself, right? Like, there are other people who are also smart that I work with who can answer questions in my absence, right? And so, like, there's a reason there's a couch in my office. When I'm overwhelmed, that's where you'll find me, right? Because I just need to be somewhere comfy. There's a weighted blanket over there just in case, right? So I think, yes, the nap ministry. Thank you, patience. Yes, such a great thing. So I think there is a thing about like a disconnecting and taking time off. And truly, the thing that feeds my soul is my community, right? And is my connection to those people. And I think the first year and a half of COVID was really hard insofar as those connections to my close people are such an essential part of my well-being. And I was sort of robbed of that. And then slowly, like, we're still very cautious. We're still mostly meeting outside, but like being able to just like hug my friends again has brought so much wellness and centeredness back to my life. And I do also take more naps now, not gonna lie. But another thing that I think, a friend of mine did this during COVID when her partner was diagnosed with long COVID and she suddenly became a caretaker. And I think it's brilliant, and I'm now encouraging everybody I know to do it. She set up something called a benevolent care society, which was basically just a group text with about 12 of us. We don't all know each other, but we all know my one friend in the middle, right? And when she is struggling with something, she sends a text to the Benevolent Care Society, and whoever has the time, capacity, energy, space, resources to address that need steps up to do it. So there is no individual like, oh God, if I don't show up in this one instance, then I'm a bad friend. But there's a crew of a dozen of us who are all showing up to support this person that we care about. And sometimes it's like, hey, can someone swing by the pharmacy and pick up this medication? Or like, hey, I'm just feeling really down. Is anyone free to call me this afternoon and check in? Or, hey, we're going out of town for 3 days. Can someone stop by and feed the cats, right? Whatever it is, there's 12 of us. Most are in Seattle, but some are not. And those are the folks that are like, yeah, I can give you a call. I'm free. Or, you know, sometimes if she wakes up in the middle of the night and can't sleep, great news. Our friend on the East Coast is like, I'm already up for work. This is great, right? But this sort of like, Martin Luther King used to talk about a beloved community, right? And I think that one of the things that's been key to my wellness, especially over the past 3 years, is feeling like for the first time in my life, in my mid-30s, I really have a beloved community, right? I have close people that I trust, you know, or like, as my partner likes to say, I now have a list of people that I could be confident would come visit me in the hospital. Right? Like I had much more sort of shallow surface level friendships for a long time. And I'm forming much deeper connections with my friends and my community now. And I think that that has been, it's been essential for me over the past 3 years, right? And I think part of that is because I have this beloved community that gives me inspiration and meaning and all of these things, I'm not seeking them from work as much, which means I can disconnect from community, from work a little bit more because I have meaning in my life outside of that like 40-hour-a-week job that I'm paid to do. So I think that it's been really, really good for my soul, and it's been really good for my marriage, and it's been really good for my mental health.
Absolutely. We have one more question from the chat, and I'll read it out to you all. We also have about 4 minutes to answer it. So we'll be rapid fire answers for our last question.
Is the question about what tea cooked?
Although, no, that is another question too.
Okay.
Audience members want to know what you cooked for your dinner. But another question for all of you is, in your communities, within the spaces that you promote public health, what does advocacy and solidarity look like to uplift women and non-binary people in global health? So rapid fire. What are your answers?
I will let T and Ndudi take, because I feel like I've spoken to this a little bit. So please, I'd love to hear from my co-panelists.
Yeah, like I've continued to say, is looking for resources and programs that will, are intended for women. We did a project with Fred Hodge on ovarian and breast cancer, which was targeting women. And we proposed to serve 50 women, but we ended up serving 66 women. It was wonderful because we talked about, early detection, prevention, support strategies. And those are the kind of programs that we need to do more of, because we discovered that most of the women there have never even done self-breast examination. I mean, they didn't even know what it was. We had men attend these workshops because either their wives or sister or mother was going through either ovarian or breast cancer, and they had to come to learn how to take care of their loved ones. So I'm just saying, when we have programs or workshops or resources that are targeting women specifically, it really, really helps. It really helps, and it goes a long way.
Yes, I definitely agree with what Ndudi said as far as like resources, but also representation for whatever it looks like for each community. I mentioned my grandma earlier. Oftentimes her care is from non-native folks, and there's the language barrier, and then there's also the raise of eyebrow question, like, what did you do? Like, how is that helping you? And this may be in something in regards to like traditional medicine. A person could come into on the reservation been like, well, I worked with tribal communities for over 15 years. And it's like, great, that doesn't mean anything because you don't have that lived experience. You don't know what it feels like to take care of your own without being paid for it, because that's just what we are. We're just a good relative towards each other. So increasing representation across all fields, specifically I'll speak about STEM, in the medical field and the public health field, whatever that may look like. It's so reassuring when you go into a doctor's office or you're part of a research study and it's like, I can connect with you before we get into business. We can talk about, oh, you're from this tribe? No way, this is what we do. Or, just that wholesome connection, putting the person before the program or the symptom. And also I feel a lot more trusting if there's somebody who looks like me and they're going to go and tell me like what I need. So I'll toss it off to Genya.
In the most basic way, the best thing that we can all be doing for advocacy is paying attention to the legislative terrorism targeted at queer and trans people right now. And just so folks know, Washington is not immune. There are 2 anti-trans bills being discussed in the Senate right now. I think one of them was already defeated, but one of them would ban trans people in the criminal legal system from being detained with their gender. It would require them to be complicated and silly, but it would basically require that trans people in state custody be kept with the sex they were assigned at birth rather than with their gender identity. And the other one, which has the dumbest name, it's like Keep Childhood in Children or something, would require school personnel to out transgender kids to their parents if they came out at school, which is extremely dangerous, right? So this is happening in Washington too. So I would say just like pay attention to these bills, find out if the person who represents your neighborhood is supporting these things, call your legislators, make sure they know that you support women, non-binary folks, trans folks, queer folks. I think there's a lot of very divisive language out there, right? About how like there's women and then there's these other people who think they're women, but they're not women. And at the end of the day, right, we're all marginalized for our genders. And that's why we all need to be in this together. So I think at the legislative level, there's a ton to be done because we've got almost 400 bills to try and defeat this year. But then even, on your teams, in your workplaces, right? Make sure that you're advocating for your trans and non-binary colleagues, right? Are they able to use the correct pronouns? Is there a bathroom that's safe for them to use, right? How can you sort of advocate within your own spaces as well?
A huge virtual round of applause for our amazing panelists. I know we want to hear more and continue this wonderful conversation. Thank you for your questions. At this point, I will say that our panelists have said that they would be available to connect via LinkedIn or to chat in other ways if you're interested in connecting. And I now, beyond yet again another thank you, this was absolutely wonderful. I have the additional privilege to introduce Dr. Rupa Dutt, who is the Executive Director and co-founder of Women in Global Health, and she's going to say a few words about the policy priorities of Women in Global Health for 2023. So we are all going to step back and hear from her. Thank you.
Hi, everyone. Thank you for just such a warm welcome. I just want to acknowledge I came in to this session and just I'm so moved with this just openness with how the speakers have been sharing the power of communities. And I consider Women in Global Health very much an organization that creates community. And I know that communities are so critical to our own personal resilience. So as someone that has found community through Women in Global Health, it really is such a privilege to join you on such an essential topic. And I couldn't agree more than what has already been said here, that we all need to find ways to build resilience, and only through that can we really do the important work that we need to do. I'm actually joining in from another really exciting celebration here in Washington, D.C., and I know that many of you are probably supporters of Madam Speaker Nancy Pelosi. It's her goodbye party here in D.C., so I'm tuning in from that. And I thought as I kick off on talking about our policy priorities for women in global health, I would also acknowledge her leadership in the United States and as a global leader, a woman that has paved lots of ways. And one of her quotes that I really like about women's leadership is she says, "I really want women to know their power and to know their value of their experience." And she goes on to say she really understands that since women have entered into politics, it's completely changed and created a new culture. And so as all of you are women and allies from all different genders supporting the agenda of gender equality and women's leadership, I wanted to just pass the energy from here in DC. I'm going to kindly ask if the slides could be also put on the screen. As many of you know, particularly 2023 is a key global health year, especially in policy making at the highest level. There's going to be 3 high-level meetings happening on global health at the United Nations, one on universal health coverage, another one for the very first time on pandemic preparedness and response, and another one, TB. Many of you in your work probably is related to and connected to this agenda in some shape, way, or form. And we wanted to share with you what are some of the policy priorities that we are collectively around the world of 45 chapters of Women in Global Health working on. And I invite all of the community in the Seattle chapter to join us as we really aim to have gender responsive approaches to that. So yeah, I was just going to ask if it would be possible to have the slides on the screen.
Just give me a prompt if you want me to move to the next slide.
In the audience, we can see the slides.
Yeah.
Oh, okay. All right.
Yeah.
Dr. Dot, you are muted, I believe.
Great. This is the perks of trying to do the call on the phone. So I appreciate the patience there. I'm not able to see which slides we're on, so I'll just ask for a little bit of help. If we could go to slide number 2, it should look like an image with all the 5 different policy priorities on it. Oh, wonderful! I can see it now. So these are the 5 policy priorities that we have identified together with input from chapters all around the world. What you'll notice is it's still very much our core business of what Women in Global Health is focused on. We will be challenging power and privilege for gender equity in health. If we could go to the next slide, please. We're very much committed to advancing gender equal and diverse leadership in global health based on gender transformative leadership. We're going to continue to advocate for leadership at all levels. This year particularly, we will be putting a special emphasis on making sure that women community health workers who have been part of the response in the pandemic, but also continue to provide critical health services in their communities, especially in low-middle income countries. We are going to be particularly focusing on making sure that they get opportunities to leadership, and their contributions to health systems around the world are not only recognized, but they have improved conditions for decent work. Next slide, please. The second area we're going to continue to champion for is calling for a new social contract for women health and care workers. We will call for urgent action, especially to support women health workers around the world. We know that women have had a triple burden during the pandemic, and many of them are exhausted for all the reasons that I'm sure the topics covered today as well. We are seeing a great resignation in high income countries, which we imagine will be linked to a great migration from low middle income countries, further stressing health systems all around the world, but especially in low resource settings. So we're calling for governments to pay attention to this issue and work on developing policy solutions that support health workers all around the world, especially women, and from a gender perspective. This is an urgent issue, as the World Health Organization estimates a 10 million health worker shortage by 2030. We believe that this shortage is going to be even greater given the great resignation we're seeing around the world. Next slide. With the high-level meeting on universal health coverage, Women in Global Health is going to be campaigning with our Alliance of Universal Health Coverage and Gender Equality, which is a coalition bringing over 200 organizations. We have been active since 2019 to really make sure that the language that was agreed upon in 2019 is not removed. We have a very strong universal health coverage political declaration, a very strong gender mainstream document, and we want to make sure that we don't lose the gains as negotiations happen in New York in September in the lead up to the high-level meeting. So this is going to be a key area where we engage policymakers at all levels, nationally, regionally, and globally, to keep their commitment, especially to ensure that women's rights, including their access to comprehensive sexually reproductive health and rights, is available. Next slide, please. We all know that the pandemic has highlighted inequities both within societies and within countries. And what we are doing at Women in Global Health is really making sure, as there are negotiations happening related to strengthening health emergencies, preparedness and response, whether it is the pandemic accord negotiations that are taking place simultaneously in Geneva, to discussions that are happening with the international health regulations, to the pandemic fund that's been created, that all of these things will be gender responsive. And for us, gender responsive definitely includes making sure women are part of decision making at all levels of any health emergency response, as well as calling for gender responsive approaches to health systems. And there's more to this agenda if you'd like to learn about what we're advocating for, and we hope all of you are joining in those efforts. And then fifth slide, please. Finally, last but not least, we remain committed to movement and alliance building for gender equality. We know there is power in communities, and as we continue to grow, we have over 45 chapters around the world in 40+ countries. 2/3 of those are in lower middle income countries. But what's really amazing about our movement and all of you is that it's a universal movement across borders, and we are going to continue to highlight the power of our movement, but also build alliances to advance women's leadership in health, to advance gender equality in health systems around the world. And through collective action is how we're really going to transform societies at all levels. So on that note, I really appreciate all of you taking the extra bit of time just to hear about our policy priority agenda. We really hope that you make this your agenda with us, as it is something that's coming from women and all of our allies and supporters in the movement around the world, as what we'll be focusing on. And again, greetings from Washington, D.C., another Washington. And so I really, really hope that all of you are doing well, and please take care of yourself. And as we are also celebrating International Women's Day, I think that day is every day, but with all of that, again, special thanks to each one of you for everything you do to advance health equity. Thank you.
Thank you, Dr. Dot, for taking some time. And I will apologize because we asked Dr. Dot to cut her presentation down from 10 minutes to 5 minutes to squeeze in some time. So we're very grateful that you came to speak to us and share a little about these policy priorities. We will share more information on these policy priorities and how to get more engaged in our various channels. So please keep an eye out for that as well. And then I think we might have a few slides, but I know we're also at time. So I'm going to very rapidly go through and just let folks know more of how we can all get engaged. And I think patients, go ahead and go to the next slide. Let's see. There we go. Okay, so we are, as you know, a nonprofit structure. And so we are asking if folks are interested and willing to donate. We are now setting up a donation structure. We do not yet have a membership structure where we require fees. Everything is still very much volunteer based in this organization. And so to put on events, especially to start putting on some more in-person events, we're starting to think about our funding structures. So please feel free to scan this and donate if you do have that capacity and that ability. We would appreciate that. Would you go ahead to the next slide? And again, we'll send this information out. There are other ways to stay connected with us. We have the WGH Seattle mailing list where we send a newsletter out, our LinkedIn group. We do have our WGH Seattle small groups that meet very regularly in smaller group settings. And there's information on those small groups on our website. And then please save the date for our next WGH Seattle gathering, June 1st. We are hoping this one might be in person if we can swing it. So we will keep you posted. Pay attention to some of the notes in the chat, and thank you for joining us today.